Hi, how's it going, class? This is my manager interview. I was able to interview one of my fellow colleagues from my internship. I work for Developmental Pathways. Um, it was with my coworker's name is Nathan Lee. It occurred on October 30th, 2018, and it roughly lasted about 45 minutes. Um, so a little bit of information and history about Nathan. He graduated from college with a bachelor's in social sciences and a minor in history. He also has been working for Developmental Pathways for roughly 8 years. 2 years he worked with a day program, 2 years for case management, and 4 years for community outreach, the community outreach program. Um, a little bit of history about Developmental Pathways. It's a nonprofit agency serving individuals with developmental disabilities, delays, and their families. It is also one of Colorado's community-centered boards, CCB, connecting people to federal, state, county, and private funding in Arapahoe County, Douglas County, and the city of Aurora. They passionately believe inclusion is for everyone and offer services through home and community-based Medicaid waiver programs, locally funded programs, and partnerships with other community organizations, which is Developmental Pathways. Developmental Pathways was established roughly 50 years ago. Um, the rules and regulations of the organization are that employees must abide by HCPF, which is Healthcare Policy and Finance. This governs and sets the rules for the waiver programs within the organization. However, even though it does provide resources and opportunity to help the um, even though the organization does receive help from the HCPF, um, and it does provide resources and opportunities to the people receiving services, they are still limited. They are still limited. This is due to the rules of the HCPF and also to the funding provided by the state. The organization is divided into three departments. It is divided into the early intervention. The early interventions program works with infants from 0 to 3, and if people receiving services don't qualify for the CES, Children's Extensive Services, they go to community outreach and family support. The third is case management, who works with people who qualify for Medicaid waiver services, which are the CES, which only helps children, and SLS, Supported Living Services, and DD, Developmental Disability Program, which both work with adults. There are a wide variety of services clients need in this population. The services are respite, professional therapies, medical assistive technology, home modification, individual counseling, support and employment, day program for adults, hippotherapy, music therapy, transportation, advocacy, and housing, etc. The conditions which have to be met for people to receive services from the organizations are when they are the ages from 0 to 5, they must have a developmental delay diagnosis. When they reach the age of 5, they must get a developmental disability diagnosis or have an IQ of 70 or under. Um, So when talking to Nathan, it's for me, I'll have the conversation when it came to what types of clients do well within the organization, um, or succeed in the organization. Our clients that just have good communication, because sometimes there are clients that are just not good at communication and aren't straightforward about the things they need and their necessities. So it makes it hard to be able to communicate with them and be able to give them the exact services that they need to be able to succeed and prosper inside within the program. Um, on the other hand, people that do not succeed are people who don't do well within the organizations. They don't abide by the rules and regulations. An example would be a client making purchases from the person with a disability, but some of the purchases aren't necessarily towards this disability, so they don't receive the funding reimbursement for it from the agency. So whenever clients receive funding from DP from the organization, they must make sure that anything that they're spending their money on is towards the disability itself, not just buying common human needs, which is like living, food, clothing, things like that. It must be something that's essential for their disability, that helps them. That's unique to anybody else, to somebody else who doesn't have a disability and they're living. Um, it's, and then the paperwork that needs to be clean, the paperwork that is filled out is it's done annually. It's done for individuals for an annual support family plan. They also need to complete the community outreach form, signature pages, and kids who are in the WARE programs have annual papers which need to be signed as well. This paper is important because it allows for the agency to see if they qualify for the services and how much funding they are going to be able to receive for their child. I believe that I do believe for family support, it is they receive a certain amount. It is roughly the max is like 2,500, and for community outreach it's 1,000. I do believe annually, if I do remember correctly. And the paper is important because it allows for the agency just to be able to keep up annually, because clients are constantly changing their environment, their living habits, and just things like that. Every year is different. And then with case notes, they are written daily. The things needed to be written within the case notes are who you're in contact with, what you need to do with what you did with the individual, and follow-up information as information or activities needed. Some information not included would be personal identifying information like social security and non-relevant information. When it comes to identifying confidentiality requirements, the agency has individuals sign a HIPAA from a given to give consent to communicate with other organizations. If a client refuses to sign then the workers are not allowed to communicate with organizations that are trying to contact the organization about a certain client. They're not allowed to do that. Most of the time, clients are sign it and are okay with that because they don't want to have to communicate more than they have to, especially because of like their disability or people that have a disability, and they do trust the coordinators and case managers inside DP. But it's rare. It's one of those things where it's mostly if the client doesn't think that they want to have someone else just talk for them outside of the organization. And then the way the organization receives funding through the state is through state and federal funding, also occasionally from donors as well. That's with fundraisers and just when the organization is doing well and some of the families have money, they're like, hey, like here's a donation. They appreciate the services that they are receiving from DP. The way the services within the organization are monitored are through annual service plans and family support meetings. So the coordinators meet with the families, whether it is in person or through the phone, in order to essentially be on the same page with the services they are receiving. This is important because the state does audit the agency periodically to see if the families are getting these services done and the funding is being used appropriately by the families. If the agency is misusing the funding, they are receiving the risk of losing funds as well as future funds they might receive. Since states rules and regulations limit what a case manager can do, it sometimes doesn't allow for the whole doesn't allow for the worker to always help the family in every way they can. Unfortunately, funding is always one of the biggest issues because sometimes a family has a person receiving services who requires more. Since essentially there are clients with disabilities who have such high needs, $2,500 isn't a lot of money, and it's a stepping stone, but sometimes it feels like from when I was chatting with Nathan, sometimes he does it's a frustrating feeling because you want to be able to do more for so many different people, but essentially because state funding and the lack of funding there is sometimes, it is difficult to be able to help every family when it comes to those circumstances. Occasionally, though, Nathan did tell me that there is an emergency. There's an emergency funding that DP does have, but that's rare that where the coordinator or the case manager has to talk to the higher up and tell them about the situation. If it's really a dire need or a really severe situation, then they'll be able to pull out more money than the 2,500 from the emergency funding. But he told me that's a rarity. Since there are families receiving service, it is difficult to give every family the time that they deserve, because there's so many families that receive services. It's hard to like give families more and more time. You have to be really, really precise and on point. Even though families, I feel like, from the way Nathan described it, is like sometimes families just want to have more time just to talk and to go over things and just to feel like they're being more taken care of than what they already are. Even though it's great services, sometimes people just want more. It's that natural desire when you're receiving something that's good for you. So the way the organization collaborates and works with other agencies is they help connect families by receiving services with other organizations to receive services depending on the specific organization. One example was the respite care guide that I personally was able to work on as an intern. It's a guide that just helps connect families with it helps connect families with other organizations that provides respite care and like camps and stuff for children and just children throughout the year, because parents do need breaks and they need to take breaks from their kids, and it is difficult, but it's just one way that the coordinators and case managers can provide those services to the families that are receiving services when they are discussing options about what to be able to do for their kids or their just the person that is receiving the funding from the organization. In terms of communicating with other agencies, case managers and coordinators are pretty free to collaborate with other organizations as long as they are within the rules and regulations of the organization. This is because it allows for partners to be able to do events and raise more funding and to bring more awareness and to make the families not just feel like they're another person in the system, but to feel more connected with the organization. So there's events like Nine News and Health, Trunk or Treat, handing out for Thanksgiving, handing out turkey baskets to families in need. It's just those things that just help families feel more connected within the organization, and it's just it brings more positivity to the organization. From talking to Nathan, the best parts about the job is just knowing, honestly, from the way you put it, is just knowing that you're helping the family out. I mean, I can only imagine it is challenging to have a person that you are raising and have to live with that does have a disability, and you do love them and you do want what's best for them, but sometimes it is a different challenge than having to raise a normal child or someone who doesn't have a disability, and I think that in itself is such a unique perspective, unique situation and all that stuff. And honestly, he said whenever he can go to these events and be able to see the families and see how happy they are and see the gratitude that they bring because they're receiving those services. And then again, with the worst parts, it goes back to not being able to help as many more families, not having enough funding, not being able to just essentially just help change more lives and mold more lives because of certain limitations to the way things work. And not just but more specifically here in Colorado, because the way Nathan told me is like each state may vary with how these organizations and these fundings and things turn out because or work out, because every state is different. And yeah, it's pretty much what he told me about that. I mean, it's always that desire to want to do more for families, but I mean, essentially, that was pretty much the worst part. So the software being used by the organization is BUS. It is Benefits Utilization System, the Bridge, and for contact notes, Cosmo. These systems are useful because they allows to securely keep the information of people receiving services, as well as have their information organized and easy to access. And the last question that really Nathan just talked to me about his personal burnout prevention strategies is he said that's one of the perks about working the job is a 3-day weekend. So Friday, Saturday, Sunday, he gets to go home. He likes to keep work at work and home at home. He goes home with his family and likes to process, and wind down. He told me like on Thursday nights after work, he likes to go home, wind down, process what he went through. The next day, wake up, and then just leave it at what it was at work, and then get back to his family and start doing events with them, working out, eating healthy, sleeping well, and just having hobbies outside of work. And then whenever the time comes, when Sunday night comes, go back to thinking about the job. Get rid, not overly thinking about it, but to build that anxiety, but just to get in that mode of like, all right, it's time. Monday morning comes, you clock in, you go back to work, and you're ready to help these families again. Because for him, the way he described it, it's a blessing, and it's incredible what you can do when somebody's willing to help somebody else out, and it is regardless of the things that aren't so perfect and the things that you wish would more. At least there's enough, and the things they do now are worth it, and that he's proud and he's grateful to be where he's at, and that's pretty much what he told me about the burnout strategies. So, and this is pretty much how the interview went for us. It was a good conversation, just hearing his thoughts, his perspectives, and from his experiences and stuff, and it was really, really, really insightful and fruitful to hear about all of his ideas and stuff. And honestly, I could have done this interview with like 6 or 7 other colleagues of mine because they were also eager to talk about their experiences, but being able to talk to Nathan about his really gave me good in-depth insight about this organization, and honestly it makes me personally more excited to see what other agencies are like that work with different populations, but how they're all so connected in different ways. But thank you, and if you have any questions, please feel free to let me know, and thank you.